Hi, I'm Adham Bakri. I'm from Egypt. I'm a graffiti artist and a graphic designer. I came to India before in 2009, and this is my second visit. I had planned to visit the south, but unfortunately I got into a car accident in Bangalore, and I was sitting in the back seat in the middle, and a truck hit us from behind. Broke my spine, and the car flipped, and I had severe injuries in my ribs and my head. There's a skull fracture, and I suffered from concussion. Due to the concussion, I have much difficulty recalling the week before the accident. I don't remember getting into the car. I don't remember the accident itself. Don't remember who was in the car, don't remember being admitted to the hospital. My first memory started at the ICU, and of course it was a difficult time for me, but because of the facilities and the staff, they were very understanding to my condition. And later on, when I was admitted to my own room, I had a very pleasant experience at Vikram Hospital and with the staff, and made many friends, and it's great to be back here today to meet everybody and thank them personally. I don't remember the surgery either. The surgery was 5 days before the accident, after the accident, and I don't recall it, but the amazing thing is that Dr. Amritlal made such a great work on my spine in the surgery that I don't remember my spine breaking. I don't feel any discomfort. Most of the remaining pain is in my rib cage and upper back. My lower back feels like nothing's there. Nothing has changed before I got in. Since I remember, before the accident. It's really been an amazing recovery. 5 days after the surgery, I was able to walk with an aid, a walking aid, and with physiotherapy in the coming days, I was able to walk alone in the hallway, and I remember the nurses all applauding me on my first walk alone. Since then, recovery has been slow but sure. It's been 4 weeks since the accident, and now I can walk in the streets of Bangalore and enjoy watching life go by and watching people go about their daily life, and it feels human. It feels great after this experience to enjoy life normally.
Percutaneous screw fixation in spine surgery is an emerging technique. It is a very elegant way of stabilizing the spine. The size of the scar is minimal, the amount of tissue damage is almost negligible, and it gives very good stabilization to the spine so that the patient can be mobilized early. Mr. Bakri was brought to our hospital in a very serious condition. He was involved in a road traffic accident, had a head injury as well as a lung injury. He was quite serious. He also had a spine fracture. We rushed him into our ICU and stabilized him. But with the presence of the spinal fracture, it was not possible for us to make him sit, not even possible to make him turn in bed. Any kind of movement would lead to the risk of worsening spinal cord damage and resultant paralysis. So it was important for us to stabilize his spine as early as possible. I decided that percutaneous screw fixation would be the best way to stabilize Mr. Bakri. Being a very elegant procedure where the scar is very small and with minimal tissue damage, I could do a percutaneous screw fixation where screws were put into the spine, into the vertebral bones, and a rod was inserted to connect the screws and so to stabilize the spine. Soon after the surgery, the very next day, it was possible for our nursing care to be taken one step higher. We could turn him in bed, we could make him sit up, and within 2 days we were able to even make him walk. This helped his recovery immensely. Today, Mr. Bakri is walking independently. He's a much more happier man now. All thanks to percutaneous screw fixation of the spine.